Are you a woman? Are you a mother? Did you know that pharmaceuticals and medical procedures not tested on women and children are being prescribed for you and your children? That's what the Board of Editors of Scientific American, September 2012 issue states. 1/2 of prescribed medications for your children have never been tested and shown safe and effective for children. Why not? Money. Testing is, quote, rarely worthwhile from a business perspective. As for women, in Canada's National News magazine, we're told that to save money, medical research uses male lab rats, then male humans to test pharmaceuticals and medical devices used in women, even though women's bodies respond differently. So it will be no surprise that of the 10 drugs the FDA took off the market between 1997 and 2001, 8 were because of how they unexpectedly hurt or kill women. This is personal. My brother-in-law at age 14 was trying to awaken his stone-cold mother one morning looking for his lunch before he set off to school, but she had died the night before without warning. She had been taking a new arthritis drug later removed from the market. The point I'm making is the fact that a pharmaceutical product or medical procedure is legal and maybe even approved doesn't mean it's beneficial to your health. Consumer demand is gleefully embraced by the profit motive. Author Florence William, in an interview about her book Breasts and Natural and Unnatural History, stated that breast implants still have a lot of problems that women are not informed about. She says that implants are a serious medical procedure sold as consumer products. The focus of this video is another serious medical procedure also presented as a consumer product. Women, believing it is an easy and safe solution to a problem, have made it among the most common medical procedures. My name is Keith Neely. I'm a documentary filmmaker. It is turning out that this popular procedure is not safe. But why haven't you heard about it? Television networks are desperate to be first with breaking news, so you would think that learning that a consumer product medical procedure is negatively impacting women's health and fertility would be very big news. But they won't touch the story. I continue to try to persuade them. In fact, I've become a grandfather of 3 since I first proposed this critically important information become a documentary. What's holding them back? Why the silence? In a press conference in 2009, called by a medical researcher to warn the public about the serious risks of this medical procedure, university professor Dr. John Thorpe said,
"One of the intriguing things to me in the American experience has been the embrace of a surgical procedure with an inherent assumption that it had no harms, and that assumption was so strong that people were unwilling to, in the U.S., to look at the harms. And I applaud the BGOG for publishing it.
The press conference was called by Dr. Prakash Shah to release newly completed research. For your information, Dr. Shah won the 2012 Emerging Leader in Neonatology Award. This is the branch of medicine concerned with the care, development, and diseases of newborn infants. If born too soon or too small, we call them preterm, premature, or preemies. Sounds kind of cute, but it's not. These babies are known to have a far greater risk of autism, mental retardation, cerebral palsy, epilepsy, blindness, deafness, and learning disabilities. And it's a growing problem. Researchers are asking why. They have found that it's linked to the untested consumer product medical procedure. If a woman has utilized this procedure just one time, her risk of having a premature baby increased over 1/3, 36%. If she did the procedure 2 times or more, the risk increased 93%. The purpose of the press conference was to warn women of the risks of this procedure and ask for additional research to find a less damaging method of performing it. Dr. Shah explains how the procedure damages the woman and greatly increases the risk of damaging her future children. I'm going to break his answer into its 3 parts. He is speaking medicalese, so I will explain what he is saying and show you medical animation.
What sort of mechanisms do you imagine could be at work here so that the termination does actually make subsequent pregnancies carry a higher risk?
There are 3 postulated mechanisms. One is the mechanical trauma. So when you're trying to dilate the cervix to get the conceptus out, you have to dilate the cervix, and that may lead to trauma to the cervix.
Number 1, the cervical muscles are damaged because they are mechanically forced open against the body's involuntary will. This is similar to a sports injury. Imagine giving two otherwise equal people 30 pounds to carry in their arms for as long as possible. But one of those two people has an old sports injury in one arm. That person isn't going to be able to carry the 30 pounds as long as the uninjured person. Pregnancy is carrying upwards of an extra 20 to 30 pounds for 9 months. But before 9 months, the injured and weakened body says, I can't take this weight anymore, and the delivery starts ahead of schedule, ahead of what the baby needs, so it is delivered premature.
Second, when there is a curettage done, so curettage is to remove the conceptus with a semi-blunt instrument from the uterus, it does damage the underlying epithelium and may cause faulty implantation of placenta in the subsequent pregnancy.
Number 2. A semi-blunt instrument, meaning it is not blunt but actually it is rather sharp, is inserted to scrape away at a very, very tender part of a woman's body. Unlike the inside of our mouth, for example, this is a part of the body that is not meant to be scraped. This damage causes scarring that makes the attachment of future babies far more difficult. The result is that the woman may have lost her ability to become pregnant or keep a baby full term.
Thirdly, when the conceptus is removed, we hope that everything is removed. However, small amount of residuals are always left, or most of the time left, and that may act as a source of infection because it will be a dead tissue, and the infection is one of the biggest triggering factor for the preterm labor in the subsequent pregnancy.
Number 3. Parts of the conceptus, a medical word for leftover pieces of the developing fetus, are left behind. As dead matter, they get infected just like the area around a sliver on your finger goes red with infection. But when the infection is inside your body, it creates big problems. Dr. Shaw is describing an induced abortion and the specific procedure most commonly used. In the accompanying press release, he carefully pointed out, numerous times actually, that he is not against abortions. Far from recommending women not have abortions, the solution is to improve abortion techniques. However, a woman should be counseled about that risk. Again, that risk is of giving birth to her future planned babies with far higher risk of challenges like autism, mental retardation, cerebral palsy, epilepsy, blindness, deafness, and learning disabilities. I appreciate that this is startling information. For decades, we have been told that it is safe, even though it has never undergone testing. In Dr. Shaw's press conference, he was asking for more testing and for more research to either support or overturn their conclusions. By the summer of 2012, 3 new major studies confirmed the risks. Those studies are added to the list that now totals 134 studies. There is now no longer room for argument that 2 or more terminations of pregnancy markedly boost a woman's future children's risk of serious handicaps. It's called settled science because, in contrast, that would be 0 systematic studies clear induced abortions of preterm delivery risk. Thus, the abortion preemie risk is settled science. Some critics, objecting to this conclusive research, claim there were too many variables, but the confounding variables have now been isolated by using accurate government records in the countries where the government pays for the health care: Finland, Ireland, Scotland, England, Denmark, and Sweden. You ask, how can a consumer product that is capable of doing all this harm be marketed as safe? That is a very profound question because even the federal government-established IOM, Institute of Medicine, says it's risky. The IOM is part of the national academies. Congress looks to them to provide unbiased and authoritative advice to decision makers and the public. Why does Congress mandate warnings about one risk factor for preemies, cigarettes, but not another, induced abortion? It doesn't make sense. According to the most recent American census, 62,374,964 women aged 15 to 44 could choose to have an abortion without clear and compelling warnings, but just 1/5 of that number of women smoke, and they get constant warnings. 2 smokes likely didn't hurt anyone, but 2 abortions are known to put a woman into a whole new, higher risk category. Why the silence? Why around the entire Western world, as more and more women discover a fertility problem years after an abortion, or hear the doctor tell them that their baby has, for example, cerebral palsy, why does the silence continue? The September 2012 issue of Reader's Digest states, pregnancy doesn't just alter your body, it rewires every last neuron of your brain. Do you know what happens to your mind when more than 100 billion neurons start getting conflicting signals after the termination of your pregnancy? Do researchers know? No one knows. That's why doctors are calling for more research. In the meantime, I want you to ask 3 questions. First, why the silence? What do you think? Is it purely the profit motive, or is there more to it? Second, why are the promoters of this procedure allowed to use the word safe, which in English means the absence of risk? And third, do you really want your body and your future children to be part of that additional research? Isn't that what lab rats are for?